Let's just wait a few seconds before we get rolling. I think just to get the live stream started, there's a little bit of a lag. So I just want to make sure that we are ready to go. So I'd say just give it like 5 seconds and then you can go ahead and do an intro.
Welcome, everyone. Thank you so much for joining us tonight. I'm very pleased to introduce Tracy Dolan, the Deputy Commissioner of the Department of Health. I'm Ann Galloway. I'm the founder and editor of VT Digger, and I'm very pleased that you've joined us. Tracy's going to answer your questions tonight about COVID during the holidays, and I know there's a lot of curiosity about this topic, and we're really grateful to her for taking the time to be with us tonight. I also wanted to thank our sponsor, Garnet. Garnet is an integrated healthcare delivery system encompassing patient logistics and clinical diagnostics. Our mobile diagnostic service line provides expanded access to high-quality laboratory-grade testing with an emphasis on rapid results for efficient and effective risk mitigation among individuals and groups. Whether testing at our new BTV location or our mobile unit, we offer a comprehensive menu of point-of-care and reference laboratory respiratory clinical assays focused on COVID-19 and flu. Visit us at garnet.care to learn more or to sign up for testing. And now for our questions. First, we're going to hear from Sylvia of Fayston, who has an overarching question for this holiday season as we all gear up here for the big day.
Is it safe to see your grandparents or family for Thanksgiving?
Well, thank you so much for the question. Was it Sylvia?
Yes, that's right.
Thank you, Sylvia. That is a great question. And I know that everyone is really excited to spend time with grandparents over the holidays. The answer to that question is a depends. If you've been already spending time with grandparents and they're part of a small circle of people that you've been spending time with, and if everybody's healthy, and if it doesn't require travel and they're within Vermont, and if getting together with your grandparents keeps your group well under 10 people, 10 or under people, it might be okay to spend Thanksgiving with your grandparents. There are things you could do at the dinner table. If you choose to spend Thanksgiving with your grandparents, you can spread out so you're 6 feet apart from people that you don't spend time with regularly. You can open some windows. You can wear masks when you're not eating. Those might be some of the things you can do. That's if you're all in Vermont and if you've already been spending time with those people. If your grandparents are coming from out of state, or if you want to travel to see grandparents out of state, that's a different issue. Dr. Mark Levine, our Commissioner of Health, has been really recommending against travel over the holidays. So generally, we would recommend that you don't travel over the holidays. If somebody wants to come and visit you, there are some things they'd have to do. They would have to either quarantine for 14 days or 7 days and then get a negative test before they come to Vermont, or when they arrive here, they would have to quarantine while they're here, which would mean they can only stay in your house and even then not have too much contact. 6-foot spaces, masks, and not too much contact while they're here because they're coming from an area that we recognize is also high risk.
So as a follow-up question to that, Tracy, if people are staying with family, are there other precautions that have to be taken in terms of joint use of bathrooms and dishes and food and all that kind of thing? How do you deal with the aerosols in your house? I mean, it gets complicated, doesn't it?
It does. I mean, it's one of the reasons we're recommending keeping the holidays pretty small this year. If you do choose to spend time with people who are from another state, either you going to another state or somebody coming to visit you, the travel adds risk. Some of the things you can do are, again, spread out. If somebody's staying with you, wiping down the common surfaces on a regular basis. And while quarantine isn't the same as isolation, so isolation is really staying in someone's room because they're sick or because they're positive. So quarantine isn't that. However, we do recommend as much as possible to still keep away from others. You can still share some of the same common areas, but generally we wouldn't recommend long periods of time with others in the room, especially without a mask or closer than 6 feet. So wiping down surfaces, ventilating, and then, spending as much time apart as you can during that quarantine period, all of that reduces the risk. We recognize that that is not an ideal way to spend the holidays, which is one of the reasons we're recommending people stay small, stay close with the circle you're already in or with your smaller family unit.
Would it help also to spend a shorter period of time together, say an hour or two, as opposed to 4 or 5 hours, or spending the night or that sort of thing?
All of those things can help. However, we do know that it doesn't take too long for this virus to transmit, especially if you're not doing the other mitigation measures. All it takes is 15 minutes within close quarters to pass on this virus. One of the things we're seeing, as we're seeing cases now, when our contact tracers interview people, several months ago, people may have only listed 2 or 3 people as close contacts. But as people have loosened their own practices around spending time with people, we've got long lists of contacts now. And so we're seeing that, we've got spread because of that as well. So again, it doesn't take too long. So all of the things that we've mentioned can reduce risk, but the key to the holidays is keeping it small and avoiding travel where possible.
Oh, things are really, really complicated. You've talked a little bit about this, but Molly McClaskey of Chittenden County would like you to review for everyone what family members who are traveling to Vermont for the holiday must do before and or upon arrival to make the holidays safe. And so I don't know if there's anything else that you want to add in terms of kind of general safety tips.
Sure. If somebody's going to be visiting you, and again, we no longer divide counties between red counties or green counties. Right now, the travel map is suspended, which means we assume that every area is red. And so anyone coming in to visit either has to quarantine before they arrive for 14 days and then arrive. And then in that case, they would have to come directly, not using public transportation, or arrive here and quarantine for 14 days. The exception is after 7 days of quarantine in their own state, if they get a negative test and then immediately travel directly with no overnights, that would allow them to not have to quarantine when they're here. Or when they arrive, they can quarantine here. And on day 7, they can get a negative test, which would get them out of quarantine. So both of those things would be helpful and are required, actually.
Wow. Well, at least there's a way to make this happen. So next we're going to hear from Susan, who lives in Vermont also. She didn't list her town, but she has a question about her children who live in Burlington.
Hi, my first name is Susan. My question is, my adult children work in retail in Burlington. We don't live together. Is it safe to have a normal Thanksgiving family dinner since they have contact with so many people?
So some of the things I would think about, again, this is probably not going to be a clear yes or no. Are they already part of the circle that you're regularly getting together with? If you have a small group of people that you regularly meet with, 5 or 6, are they part of that already? Also, if you do get together with them, have you noticed that they are taking good precautions? So do they normally mask when they're in public? Have they had any symptoms? Have they been sick? Are they in contact with others who are also following most of the mitigation measures that we recommend? Masking, washing hands, spacing. And then how big are you planning to have your Thanksgiving? If it's yourselves and just your kids, is that a small number? Are you able to do that in a safe way where you can provide some distance in your home, open up some windows, and then again, mask when you're not eating together? So those are some of the things you think about when you decide to come together.
How hot is Burlington right now in terms of COVID cases? Is it the most cases are there right now? Of course, it's the largest population as well, but is that a factor too, just generally that there are more cases there?
Yeah, there are more cases in Chittenden. It's our most densely populated area, so that makes sense. And in general, in Vermont, we are seeing cases rise very quickly. We had predicted that cases would rise, and they are rising quickly. And so that's why we have really stepped up our concern and our caution about both traveling, particularly people coming in from out of state, the quarantine, and then the gatherings. Dr. Levine has really talked about, and the governor, while we still have some regulations that allow for larger gatherings in a formal environment, that informal environment should really stay 10 or less. And again, we're not aiming for 10. That's an outside number. Really think about who you normally interact with, and think again about the vulnerability of the people you might interact with, their age, do they have other health conditions, and are they exhibiting symptoms? And are these people, when we say trusted network, are these people that are also wearing masks, distancing, have they been paying attention to that? All of those things will reduce risk and hopefully reduce transmission.
Thank you. Next, we're going to hear from Kristen, who's also from Vermont, and she's got a question about Christmas.
Thank you. My question is, my husband and I are both in the at-risk age group, and he has underlying conditions, so we haven't seen our grandkids inside the house for months. My question is, if my son and his two boys have a COVID test before Christmas and it's negative, would it be safe for them to come and be with us in our house on Christmas Day? My phone number.
Good. We won't share her phone number. People are going to want to come over for Christmas dinner.
No kidding.
She didn't say if her son and kids were in town, but it sounds like they're local. Is that your sense, Anne?
Yes, I think so.
Yeah. And so again, without the out-of-state travel, obviously that reduces risk somewhat because we know that cases are much higher out of state. My concern there is the vulnerability of the health condition. I believe she said her husband does have a health condition. So it sounds like they have some ideas to reduce risk. One of them is getting tested just beforehand. Again, getting tested isn't prevention, but it does give you a snapshot in time. The other key there would be if her son and kids were able to quarantine and limit their contact in the days before having dinner with them, that would help. Spreading out in that house and masking would also help. So those are all things that would be helpful. The test alone isn't prevention. It just tells you that day. So if the son and the grandkids were visiting with a lot of people, a day before their test, that test the next day wouldn't really tell us much about their risk level. It's really the behavior that tells us about the risk level. So if the son and kids are able to either quarantine or really limit their social contact before they get together with the grandparents, all of those things would help. Ultimately, you have to make that decision. My concern there is the age and the vulnerable condition, and whether or not they might be able to sacrifice and separate this out. Can they do it through Zoom? Is there any option to have some aspect of this outside? I know that's difficult, obviously, in the winter, so I don't have a clear yes or no, but my concern there would be the age and the vulnerable condition.
I think it's interesting that you said that the behavior is more important than the testing. Do you find sometimes that people want the testing to solve for a problem that isn't solvable? I mean, if you're, like you said, if you're spending time with a lot of people in advance of having the test, you could be exposed and then the test would be meaningless, right?
It would be, and but it's so tempting to want to tell yourself, well, I got a test, I'm good to go. Who doesn't want to get together with people over the holidays? In my case, my kids' grandparents are 3 houses away, very tempting to come together, but we're not spending time regularly inside. And so to suddenly decide that at this time, when cases are this high in Vermont, okay, now's the time we're going to decide to come together as a group, that gets really tricky. If this were several months ago, it would be a different picture, when we had very low numbers of cases, but it is different now.
How do you set the Thanksgiving table? I mean, how do you sit to, how do you eat?
So I can tell you what we've been problem solving out loud with our family. So we are thinking about whether or not we're going to do Thanksgiving together, 6 people instead of 4 people. And one of the things we've been thinking about is that there's a table in one dining room area, and then there's a table over in the kitchen area. Could we have the pods that normally are together separate into those 2 tables and have that distance And if we come together closer, can we wear masks? Can we have, wear warm sweaters, open up the windows? Those are some of the things we're looking at. And we'll decide probably much closer and look at all of our symptoms. I have a cough today, which is why I'm not with you. So I actually got tested today. So I had to make that decision this morning. As much as I wanted to be there with you, I realized I have a little bit of a cough. Now, my daughter was tested last week. She tested negative. I like to think what I have is her cough and I'm probably negative, but I don't know for sure. So the behavior piece was not going to be with you. And then the assurance piece for me, partly because I'm the deputy commissioner and I don't want to be part of some outbreak, was to get tested for me. But the piece was, regardless of my test right now, I need to not be around you because I've got a cough and I'm uncertain.
Well, thank you for modeling good behavior. I admired your email this morning. When I read it, I thought, wow, that's great. The deputy commissioner is following her own advice.
Yeah, I am no Mother Teresa, just to be clear. But what I've learned in this job and what I've learned by watching my colleagues who are working tireless hours, I just have to give a shout out. The number of hours my colleagues are working, and particularly right now with this increase in cases, is huge. And so to think that I could add to their workload needlessly, weighs on me. And so everything I do, I also think about, do I want more people in the lab? Do I want more people calling people because of something I might have done?
That's really, it's this tension between people really wanting to be together. I sent you an email earlier today about how, in the past, media organizations often write stories or interview people who are worried about having antagonistic conversations about politics or whatever over the Thanksgiving dinner table. And, overwhelmingly this year, I think people just want to be together. And so many of the questions that we received have been kind of heartrending in a way because people just want to be together. And on that note, we'll move on to the next question, which is from someone who's anonymous, but it's an important question about college students. And so we'll hear now from the next person.
Hello, it's Lisa calling from Shelburne with part B or D of my question. So if my son is positive, COVID positive now, several states away, coming home for Thanksgiving, kicked out of his dorm, if he quarantines for 2 weeks where he is, what does he need to do after traveling all the way from several states over as he's entering Vermont? What other exposures might he have if there's a mutation along the road?
Sure. So it sounds like he's quarantining at his college, which is good, but it sounds like then his travel might be through public transport. I wasn't clear, but if you're traveling on public transportation out of state coming into Vermont, then you need to quarantine when you get here. If he's staying with his family, that means being in the house with his family and he can interact with his family again, keep some space, wear the mask, but quarantining in a private residence is fine. And the family hosting him does not have to quarantine. They can still go about their business. Again, because we have really high activity right now, we would recommend everyone try to limit a lot of that business in terms of, limit your trips to the market, limit your social circles. But if he travels from out of state and using public transportation or has to do an overnight or two, then he should quarantine when he arrives as well. He could get a test after 7 days, and if he tests negative, then he's free to be out of quarantine. And then his family, we're recommending that if you host somebody for the holidays, you also may want to get tested after they leave.
And could you explain again the difference between quarantining and isolation? I think you said that isolation is if you've tested positive for COVID, then you have to stay in isolation for 2 weeks. Did I get that right?
Yeah, isolation really is about protecting others from infection. So if you're isolating, you're really staying in a room. People might be bringing meals to you, sliding them through the door. being very careful about any common surfaces if you are using a bathroom that anyone else would use. But it's really about someone staying in a room. I mean, it's not easy to quarantine. I'm sorry, to isolate when you're sick. Or if the health department or your physician advises you to isolate, that's what that means. You're not going outside, certainly not going to the market. Quarantine also, you're not going to the market, but inside a house, you could be outside of the room. Again, keep the space because we don't know your status, and wear masks when you're with others, but you may share a meal in a room, but just use some precaution. 14 days for isolation if that's what's advised. Again, if you're a case, the Department of Health will advise you on testing, et cetera, as you go through that. For quarantine, we recommend 14 days, but if you don't have symptoms, you can test at day 7. And if you're negative, then you're free from quarantine.
It's so nice that now we have the tests available. That wasn't an option back in March and April. And
yeah,
that helps. That extra 7 days, I think, can be really tough for folks. So that's good to know.
yeah, it might take a couple of days for you to get your result back, but while you're waiting, you still have to quarantine. And it's not easy for any of us.
And you're doing that now, right?
Yes. I'm quarantining until I get my test result back. Yes.
Right. So that you'll be done right before Thanksgiving. Is that right?
No, I'm just waiting right now. My test result will come back probably tomorrow, the next day. I just got a test today. So so once it comes back, I should be fine, assuming I'm negative. If I'm positive, then I'm isolating.
Right. Well, I hope you're not positive. Well, the next person is Ellen, and she's going to talk about being high risk and having some worries about that.
Hi, my name's Ellen. I'm calling, wanted to ask about COVID and the holidays, and wondering if being high risk is, my husband and I are high risk, and we'd like to have our kids and grandson visit, and wondering how that would work if they were to quarantine prior to visiting. They live in Vermont also, but in a county that has higher COVID cases than our town does, and wondering what that would look like as far as quarantining, and also as far as testing, if that would be a part of the quarantining, and for how long they would need to quarantine.
So if they're coming to visit you within Vermont, that does lower the risk a little bit. I think it's a great idea if they quarantine before they visit you, particularly if you're high risk. So they could quarantine in their home for 7 days, get a test. And if it's negative, then you'd want them coming, directly soon after that, because of course that negative test is just for that point in time. But the quarantine ahead of time would give you a better sense of their activity prior to that test as well. And so I think a quarantine and a negative test, and again, keeping your numbers small, would reduce your risk there. If you're not feeling well, you might want to consider whether or not you want someone in your home elevating your risk at all. And I think you're going to have to determine, I'm not clear when you say high risk, what puts you at high risk. So that's something you might want to also talk to your primary care provider about.
Could you talk a little bit about some of the conditions that are most worrisome in relationship to COVID?
Sure. Respiratory conditions are worrisome. Many chronic illnesses are worrisome. And then simply being an older person all by itself is a risk factor from what we can see from the numbers. Having a heart condition is a concern as well. If you go to our website, you can learn a little bit more. We have a COVID link, and we have redone our pages, so it's easy to find. And you'll learn a little bit more about what might put you at higher risk.
I have to say the state has done a phenomenal job. You were talking earlier about all of your friends who are working so hard on this issue, and it's just been phenomenal, the effort the state has put into this. So it's yeah.
I've always loved working for the health department, but it's a whole different level of pride to be part of it. I am really honored to work under Commissioner Levine, to see his leadership, but also we've got a governor who has stepped back and let health really take the lead, which is how it should be. But in a lot of states, we see it isn't. So I feel really fortunate that we are able to lead with public health first. Obviously, the economy is a huge issue, and not having a robust economy affects people's health as well. But the first decisions are driven by public health, and that's been great. And yeah, our staff are flat out, but they are passionate and dedicated. It's been hard to get some of them to take time off that they need because there's an urgency around this. And, you know, this is our time. This is public health's time. And it's hard, but it also feels really important and really useful.
It certainly is really important. So we have a question from Alex that is more general about how the state is, the state's plans going forward.
Hey, Ann, just chiming in here. I don't think I have the audio file for this one queued up. I'm sorry about that. Can you read this one back?
You bet. Does the state have any specific plans to start implementing any more aggressive measures, given that we have such a rapid rise in the COVID numbers?
Well, you're definitely seeing us start to message a lot more urgently about some of the caution. We saw now the travel map was suspended yesterday. So that's one step up. Now saying that it doesn't matter which place you're from. If you come into Vermont, you have to quarantine or quarantine prior to coming and then travel directly. We're also seeing more emphasis on small gatherings. While that hasn't come out as a mandate, the governor and Dr. Levine have clearly stated that we want people to really limit their social gatherings. While we're hoping not to go back into any of the previous policies about shutting down, we're certainly encouraging people to be thoughtful about when they're going out and what groups they're being with. We're seeing now with the ski industry really tightening up. We're going to have the tightest regulations on the ski industry in the country. Again, these are really hard decisions to make, but depending on how we go, obviously things could change and we might even need to tighten up more. However, a lot of this is also in the hands of Vermonters. Real prevention of this is, you know, the masks, the 6-foot spaces, staying home when you're sick, and please follow the quarantine and the isolation. Early on, everyone picked up their phone and we had a really compliant population around this. Now we're finding more and more, some people don't want to pick up their phone because they don't want to find out that they're close contact, or they don't necessarily want to tell us who they've been in contact with. And so that is starting to pick up. And that's a real concern because so far we've been able to contain. Now we have a little more community transmission, but we're still trying to really work on containing some of these outbreaks. But that means you really need to tell us. And then you really need to follow the directions that we're giving, because this is about your health, the health of those around you, and particularly the health of those most vulnerable, the elderly, people who already have other health conditions.
Well, thank you for that reminder. I think as the commissioner said yesterday, it seems that people are suffering from a little bit of fatigue.
Yeah.
And that's only natural. It's been 8 months now and people have been very good, and it's hard to be this good for this long, especially going into a long, dark winter. And you know, with the time change, things getting dark now at 4:30, it's people get a little stir crazy when they can't get together. So it's only natural. Well, our time is almost up, and Tracy, I want to thank you for spending time with us when you're so busy helping the state keep on top of this pandemic. It's really great to have you with us, and I'm really grateful, and I know our readers and listeners are too. So thank you for being with us. And I also want to thank our sponsors one more time. Garnet, which is an integrated healthcare delivery system encompassing patient logistics and clinical diagnostics. Our mobile diagnostics service line provides expanded access to high-quality laboratory-grade testing with an emphasis on rapid results for efficient and effective risk mitigation among individuals and groups. Whether testing at our new BTV location or our mobile unit, we offer a comprehensive menu of point of care and reference laboratory respiratory clinical assays focused on COVID-19 and flu. Visit us at garnet.care to learn more or sign up for testing. I want to thank you again, Tracy, and our viewers tonight, and good luck with your test results. I hope they're negative, and I hope you have a great Thanksgiving. Thanks for being with us tonight.